Thank you. I think I should say Terra or something like that. That's as far as I can go in Estonian, so don't try to test me in Estonian. I will be able maybe to give my talk in French or in Spanish, better than my English, but anyway, we'll try to do and talk a little bit. I know there has been a little bit of changes. There is 2 titles for my topic because I was first asked about something, and actually what I'm going to do is talk about diabetes and how to do the post-operative care in our patients. Maybe you don't know, I'm a periodontist. I'm from Spain, and I actually live in a place that is always 22 degrees all year around. So in Gran Canaria, whenever you want to visit, just say hello. I will be there sometimes. But what I'm going to do, and is important for me to bring today, is that diabetes is a big problem in our societies. The number of people with diabetes in Estonia is quite similar to the ones in Spain. Is growing, and one of the problems that we have as dentists is that half of them, they do not know that they have diabetes. So when they sit at your chair, some of them, they don't realize they have had diabetes for more than 5-10 years, and they don't even think that they need any medication. And you think that they are in good health. So what happens when you have someone that you think that is in good health and you start performing periodontal surgery or implant surgery? Many times you fail, and you don't know that you fail because you didn't know that they have diabetes. I've been involved with diabetes for many years, and with the opportunity that was given to me by the Estonian Dental Society, that I want to thank, and also by Sunster, that backs up some of my research, I'm here. And that's one of the things that I would like to review with you this morning. As periodontists and as dentists, we perform many surgeries. And usually, we think about how good we did it and how well we do it. But when the patient leaves our office, very often we give them some instructions and we don't really control what happens in the first 2-3 weeks of healing. For every patient, and especially for diabetics, you need to be very careful about it. So we're going to review. This one should have some sound. I'm going to review what you can find nowadays. This is an office in the United States.
Such as with wisdom teeth or bone graft.
This is the kind of instructions that we give to our patients.
Continue overnight. To stop the bleeding, fold a piece of gauze into quarters and place over the surgical area.
I'm sure every one of you, after surgery, gives in different ways this kind of instruction.
Change the gauze as needed until the gauze is light pink and no longer saturated with blood when it is removed.
We focus on many things that worry us, but we don't focus on things that we should worry about, because our patients are not very good at keeping good care of our wounds, of their wounds.
Especially following meals and brushing. If you are concerned that you are unable to bring the bleeding under control, feel free to call for advice. Postoperative pain of some degree will always,
and when you look at the literature, as we will see later on, for us, as instruction to our patients, the first thing we talk about is pain. And I'm not saying it's not important, but there is other things that are more important on the long term for the healing of your patients.
Prescription pain medication has been prescribed during your appointment. Please take as directed. If you are able, taking both NSAIDs, such as ibuprofen, and the narcotic pain medicine, such as Percocet or Vicodin,
as you can see, this is an American video that you prescribe a lot of narcotics for pain medication.
Do not drive or operate machinery.
I advise against that kind of prescription. Even if I lived in the States for 6 years, I don't see the need to prescribe any opioid to control pain after oral surgery.
side of the face during the first 24 hours after surgery. Keep your head slightly elevated when awake and at night, using an additional pillow if necessary. Moist heat can be applied starting on the 4th day to help resolve any swelling that has occurred. Do not smoke for at least 4 days following surgery. Smoking will delay healing and increase postoperative pain. Most sutures will dissolve and fall out on their own within a week.
We'll talk about
If they
this
become
for a little
bothersome,
while
they can
later
be
on
removed
because
after postoperative
that's another
surgery.
subject.
If
As
the
dentists, we
surgery
don't
fails,
pay
you
enough
can
attention,
remove them.
and that can be a
It is
problem
necessary to keep your
for
mouth
healing
clean
and oral
after
hygiene.
surgery, but take care not to aggravate the healing areas. Avoid spitting or rinsing for 24 hours. Gentle toothbrushing should begin the day after surgery,
We have
but
to be
avoid
very
the
careful
tender
about the
surgical
toothbrush and how we
Salt
recommend
water
to our
rinses done
patients.
after meals can
And
help
there's
to keep the
something that
surgical
I've been
areas
told that
clean
here in
during the
Estonia
healing
also people
process.
recommend salt water.
Good nutrition is
I don't see
necessary
the
for
point.
healing after surgery.
There
Be
is
sure
much
to
better
aggressively hydrate,
antibacterials
drinking
on the
plenty of
market
fluids
than
after
to
your
prescribe
surgery.
salt water after
A
surgery
soft
to
diet,
our
such as
patients.
smoothies,
So,
mashed potatoes,
as you
and
see,
soup,
this is
can
very
help
common.
with
In
surgery.
any dental office, we give instructions more or less in this way to our patients. But usually, after that, we forget until the patient comes back. We'll see at the end of my presentation that we have to be more careful. As I mentioned before, when you go into PubMed and you look about postoperative care and periodontal surgery, what do you see? Pain, 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 and so on. And as I'm saying, pain is important, but we need to be careful about some other things that are important to every one of our patients and even more for people with diabetes. What do you know about diabetes and what will worry you? What has to worry you is how long they have been diabetics, how well controlled they are, and how well they know their disease. That's something very important to everyone. But anyway, any environmental and behavioral aspect, like smoking and poor oral hygiene, are going to impact the outcome of our surgery. If to this you add diabetes, uncontrolled diabetes, you know that you are going straight to a failure. So you have to be very concerned about the medical history of those patients. It's a very good paper that I recommend to read. And this is a case of a very young woman, type 1 diabetic, well controlled, that needed at the time some mucogingival surgery that we'll see later on. And I'm going back to an aspect of our practice that we don't really pay too much attention, the use of sutures. When you perform a surgery, you place implants, just think on the business side of your model. You are placing to your patient an implant that is expensive. Sometimes you are placing a bone graft, a membrane, and so on. So you end up, why will you close with a cheap suture? Use something that will help you and help your patient to have a good healing. So this is one of the papers that I really recommend you to read. It's on Periodontology 2000 from a few years ago, but it's a very good paper to read. As you can see, we can use Dexon. Surgical silk is maybe the most common suture used in Spain. I don't know about Estonia, but it's a very common one, cheap, and not the best one. So try to avoid using silk when you do periodontal or dental implant surgery, because the outcome of whatever you'll do will be much better. As you can see, the tissue reaction is quite high. So nowadays we have other options. For instance, Prolen, with a problem, since it's a monofilament, the patients sometimes they do not like it afterwards. But Gore-Tex or any EPTFE suture nowadays has almost none of tissue reaction and is very easy to use. It's more expensive, but when you are spending around 600 euros for one case, why would you try to save 2 euros on your suture? Knowing that on the 3 weeks after performing the surgery, that suture will make a difference. If you use silk, even if the patient has a good oral hygiene, the healing will not be as good as with Teflon suture. The other thing is like, there is paper that show you that down the road, 4 or 5 months, the difference is not really a big one. But in the first 3 weeks, that are the critical ones, especially if you place an implant, if you place a bone graft or a membrane, use a good suture. Use something like Teflon, because the healing will improve very much. So you have to really pay attention to those details when you perform surgery. This is a very old case that when I was training as a periodontist in Houston, but I like to show it very often because you know that regeneration, periodontal regeneration is coming back to our offices. For many years, we thought that implants will solve every case for any of our patients. One of the problems I have is we've been placing implants in people that didn't take care of their teeth. So if we don't train them and teach them how to maintain and keep those implants disease-free, we are going back into another problem. So it's much better, and that's my bias as a periodontist, it's much better to treat people's teeth, try to have them in good health, and use implants when necessary. Not because we have a defect like this one, do an extraction and place an implant. The reason why I like to show this case, that is quite old, is because when you perform surgery, you have to be very careful in what you do, go into details to finish and clean very well everything. And once you are done and placing, this was a Gore-Tex membrane, they were not easy to place, but you were placing, you were able to suture everywhere. We didn't have enough, so in this area we finish with silk, that I do not recommend, but at the university and not having a lot of free suture, we were using the suture that was with the membrane and added some more. But the only way and the only reason why we did this is to avoid tissue reactions in this area. And why I'm showing you this? Because it was at the beginning of guided tissue regeneration. We didn't know as many things as we know nowadays about how important is the design of the flap, how important is the tension. And as you can see here, there is tension in this area. What happened? This happened. And what happened? With the Gore-Tex membranes, we needed to remove it because there was bacterial colonization. If this flap had been performed without tension in this area, we wouldn't have had this. It would be nicer for me to show you successful cases, but I think we'll learn more from cases where something like that occur. So when we're doing periodontal or implant surgery, we have to be very careful into details. So this flap, we needed to avoid tension here. If we hadn't had tension here, there will be no problem here. So things and details are important when you do surgery. When we look into sutures, is a subject in the literature, there is not that many papers because we like to go into other kind of procedures that we like more to show and everything. But a suture is a very important thing. And this is one I like a lot because it's from Harvard University, and they prefer absorbable sutures in many cases. And that's very American. They prefer that suture because in that way they avoid to see the patient for a time, and sometimes they avoid chair time for the patients. But as a member of a group that is reviewing guided tissue regeneration in Europe, we try to advise people against that. We want people to go to see the dentist after the procedure in order to be sure that the healing is correct, that we can avoid problems. So, as I said, this is very, very American. It's just a business kind of way of thinking, but we really try to recommend non-absorbable sutures for regeneration or dental implants. When we see a paper like this one, and this is also a very nice one, what happened with silk? Inflammatory tissue reaction. What happened with diabetics? They have a lot of problems with inflammation. What is periodontal disease? It's an inflammatory disease. So don't add something that you could avoid when you perform a procedure. You have to choose the right suture. It will improve the wound healing. This is the same type 1 diabetic girl a few months later after the mucogingival surgery was performed. Periodontal disease and diabetes has been one of my topics for research for already quite a few years. I shouldn't say how many because you will realize how old I am. I don't want that. No, I'm just kidding. There is a bidirectional relationship. And when we have people that have diabetes and periodontal disease, it can be like a time bomb in our office. Some of them, or a lot of them, end up losing their teeth. They have a bad oral health, and they end up having problems with their diabetes. So that's important that we realize how important it is to take care of the mouth of people with diabetes. And for people with diabetes, it's very important to know that they need to take good care of their mouth. Unfortunately, endocrinologists are very slow to reacting to this. I personally started in Spain 17 years ago to work with endocrinologists. And at the beginning, they were looking at me like, this is the crazy dentist that is coming to tell us that we need to clean the mouth of our patients. Nowadays, we have a study group with the Spanish Society of Diabetes. We have a protocol that is designed to detect type 2 diabetes at the dental office, because it's been established that one of the authors that helped establish this was Jenko, and in the United States there is already a protocol like that, and there is another one coming in Italy that all of them backed up by Sunsar. And what we're trying to do is try to detect those people that think that they are healthy. They go to the dental office, and through a test that is called FinRisk, and some other periodontal tests, we have to detect if they could have diabetes. If they get enough points, we send them to see the physician. But it has been established that the dental office is one of those points where diabetes can be detected. And I'm saying detected, not diagnosed, just in case to avoid physicians to get jealous of us. But anyway, is one of the points that we're trying to improve in our Spanish dental clinics. It's very important for us to differentiate between type 1 diabetics and type 2. The number of people with diabetes that is growing exponentially, very fast, is the type 2 diabetics. Type 1 is more related to other conditions, but type 2 is related to our problems with people that do not move, the obesity and things like that. And the people with type 2 diabetes, they have a high prevalence of advanced periodontitis. So as dentists, we risk to see them very often. And if we only look at their periodontitis, we are missing part of the problem. Because if we only treat them for their periodontitis and we don't detect that they have diabetes, our treatment will fail in the long term. So every time that we see someone, even if they don't tell us that they have diabetes, then they have a severe or advanced periodontitis, we have to think they could have diabetes. We know that a poor glucose control results in increased bone loss around teeth. So it's an important thing to check with those patients. And also, we need to know and we need to advise them about their problems with periodontitis, because the periodontitis can increase the complications with the diabetes. This is one of the papers that we did in Spain. I hope everyone is able to translate it. So it's one of the papers that we wrote a few years ago, reviewing the literature. In here, half of the authors are periodontists and the other half are endocrinologists. It was the first time in Spain that we were working together, endocrinologists and dentists, about this subject. And right now, every time that the Spanish Society of Periodontology has a meeting and we are going to do something about diabetes, we invite an endocrinologist. And every time the endocrinologists at their annual meeting do something about oral health, they invite a periodontist in order to increase the knowledge about this problem. And for us, it's been a long run, but actually we are very happy because after, as I said, 15, 17 years ago we started, nowadays we get a lot of interactions with the endocrinologist. And that has been good as far as informing and educating the society. And people should know that we need to, that they can have problems that are not only related to their teeth, they are related to their general health. As I said before, inflammation is very, very important in people with diabetes and periodontitis. We know how to treat diabetes. We know how to treat periodontitis as dentists, but we know that nowadays that we can help people with diabetes to get a better quality of life. Retinopathy. Now a dentist talking about their eyes. The reason why I'm bringing this up is because this glycated hemoglobin for people with diabetes until they are around 7–8% is considered normal. But there is another aspect that is important. How many years they have been uncontrolled or controlled for their diabetes. People that have had a bad control of their diabetes for over 10 years, they are an easy target to get retinopathy. When they have had almost 10 years of uncontrolled diabetes, they start to show very severe periodontitis. And I'm again going back to the problem. The type 1, they know they have diabetes. They need insulin to live. And the number of type 1 diabetics, Finland is one of the countries with the highest number of type 1 diabetic patients. But the problem for us as dentists is the rising number of type 2 diabetic patients. So if someone has diabetes, but they don't know, because it doesn't show, it's a silent disease for a long time, like periodontitis. For many years, they can be over here, 9, 10, 12% of high glycated hemoglobin. And they don't know. They show up one day at your office, oh, my teeth are moving. Because they don't know that at the same time they were developing periodontal disease. When you start treating them, if you don't refer them to their physician to lower this number, to lower the glycated hemoglobin. You can do as much as you can to treat their periodontal disease, or to place an implant, you will end up having trouble with them. So it's very important, and for us, we recommend a very, very long medical history to every one of our patients, because it's the only way that we can detect some of those things. But at the same time, do we have a protocol? When you look at the NICE guidelines from the UK, there's no protocol about this. We've been trying in Spain to have a new protocol about what to do when you have a patient with diabetes. And one of the papers that we finished recommend a few things. And this is always either for periodontal surgery or for dental implants. If you have a diabetic patient, you have to give them early appointments. Why? Because they take their medication. If they are type 2, they take a pill, or even there is some injections nowadays for some kind of treatment. Early in the morning, they have breakfast. And today I asked at what time is the regular time for lunch here in Estonia, because from Spain we eat very late, but here in Estonia it's around 1. Let's say you have a patient with diabetes that is coming for some dental impressions at 12:45. He had breakfast early in the morning, he took his medication, and at your office they told them 12:45 is the first opening that we have. You may end up having problems with that patient because his blood sugar is going down very fast. So you don't want that to happen at your office. So what do? Give them always early appointments, either type 1 or type 2, because of the medications they take. Try to give them short appointments. And when you talk about dental implants, you are going to place a few implants. Try to do it in 2 surgeries instead of 1, if it's possible, to keep those surgeries shorter. At the same time, the healing will be better. But it's important. You need to have always water and liquids available. You need to have sugar at the office, or some kind of orange juice, just in case those people are going down. And the first thing, if they get mad at you, don't be mad at them. When people are having trouble with their level of sugar, one of the first things that happen is that their mood changes. So if you see someone that is changing their mood at the chair and they're getting very aggressive, think that one of the possibilities is they are going low on sugar. So those are some of the advice